Hi, I'm Ryan Natal from the class of 2022, and I'm from Great Falls, Virginia. One of my favorite site locations was Puentes de Salud. They have a Spanish population there, and kind of learning about their culture and even working with a translator was something that was really interesting to me. Working with a translator is difficult because sometimes you just want to speak directly to the patient, but that doesn't work with someone that doesn't speak your language. So you kind of have to keep the patient in your focus, but you also have a translator there that's, kind of helping communicate these thoughts and feelings to you. So, there's a third party involved, but it is necessary. So you're just kind of playing around, trying to figure out what the problem is. I think there's always this one case that jumps out. It was at Spectrum, and I was working with Dr. Jensen. Patient came in the first day with, she had pain in her mouth, she had broken down teeth, a lot of missing teeth, and carious teeth. We took x-rays and determined that she needed full mouth extractions and complete dentures on her maxilla and her mandible. She spoke Spanish, and her husband actually translated. He spoke English. And so, kind of communicating to her that something that's, difficult to hear is that, we need to take your teeth out and we're going to replace it with a prosthesis. Working with Dr. Jensen and learning how to communicate those things while being compassionate, was something that kind of vibed with me. And I was lucky enough to, see her from her initial visit, listening to her chief complaint, working her up and making a treatment plan, to doing all the extractions and making the denture. And I think that last day, giving her denture, putting it in, it feels great. She loved how it looked. She had a beautiful smile. I think that was one of the most rewarding things that I've experienced at the community sites. I think kind of the same things I said before. Communication was number one. That was the biggest thing. And compassion. I think, that's something that can be utilized for every patient, but it was really stressed in the community sites, especially over there. We have these community sites because of, barriers to healthcare. And I even noticed over in the community sites that there were differences in health literacies. And so utilizing different ways to communicate that to patients, really proved effective with them, and something that I've utilized with every patient that I see. I would say there was a little difference, not big, but something that was noticeable. Health literacy definitely seemed different in the community sites as opposed to the schools, but that's a challenge you kind of find everywhere. And again, honing in on your communication skills was a great way to just get through to some patients what you're trying to introduce to them. I would say one piece of advice for the upcoming classes that are going to start at the community sites, just be confident in yourself up to this point. You're already a great clinician, and even though you're in a different site, you're working with different patients, just hone in on those things communicate like you always have been. The more you hit on those things, it's going to be more rewarding for you in the end.